Hello, Dr. Kelly. It's Tim. Hope you're doing well whenever you are watching this video. Yeah, I guess I will begin with the handling practicum. So for the first thing that we want to do is change the positioning from supine to prone, sorry. So first we are going to check the baby's vitals and just their alertness around where they are at. So I will gently be putting a hand on the baby. I'll do that. Excuse my dirty apartment. So yeah, I'll be putting a hand on the baby just to let them know that I am here. And yeah, I will be handling them today. I will be asking for consent that I can handle the baby, of course. And so yeah, while we're doing that, we want to make sure that we get the baby in a physiological flexion. So we want to bring the hands to midline and around the shoulders. And then while we're doing that, we also want to bring the legs up into midline as well and bend them a little bit. And we want to make sure that the hips are flexed as well. So, so we wanna, while we're doing that, they are in physiological flexion, and we want to support the baby's neck and head while rotating them gently and softly. So we'll have the baby's head right here. We'll have them all together. Ah, sorry about this baby. She's a little strong. So yeah, we will grab the head right there and then gently roll them, not to mess up any of their vitals or anything like that. So we want to put them in that position while keeping the shoulders rounded and the hip flexed. So prone positioning does provide some support that assists in maintaining flexion of the hips and the shoulders, similar to what they do in the womb. Okay, so babies need to have their positions changed about every 3 hours, and the whole bed needs to be changed every 24 hours. Okay, so that is the first position that we're going to be doing. The next thing we are going to be wanting to do is swaddling. So I will grab my blanket and I have it right here. It's a pillow sheet. I'm going to have that right there. So yeah, we will grab this pillow sheet right here. And the purpose of doing the swaddling is to be able to incorporate sensory and motor borders. And yeah, it's also to make sure that the baby does feel compressed and comfortable, since it does resemble the way they are in utero. Yeah, so we will grab our baby very gently, very carefully, of course. And we want to make this into a little bit of an L shape right there, as you could see. So we'll grab the baby, put them right there very gently. Make sure that they are physiologically flexed and all together. And then we want to bring the right side over here. Make sure it is tight, but not too tight. And yeah, make sure to tuck it in on all the places right here. Okay, looks like she's tucked in. And then what we want to do is we want to bring this other side, the left side, around here while tucking it in the back. So I'll do that right now. So it's tucked in right there. It's not too tight. And then we want to bring this bottom part right here and make sure to tuck it in on this part right there. Okay. So now that she is put together, we want to make sure that the trunk is supported and the head and neck are in control as well. And voila. we have our swaddle baby. Okay, so that is that. I'll put her down right there. Yeah, I believe I'll be seeing you next at the Harry Jersey Center since I recorded that earlier. So yeah, I will see you there. Okay, so the next thing we would want to do is cheek support. So the reason why I would decide to do cheek support is due to my baby having a high suck swallow ratio. This is when they do more than 2 to 3 sucks per swallow. The purpose of doing the cheek support is to enhance the feeding efficiency of poor feeders. It decreases the size of the oral cavity and it stabilizes the cheeks. The pressure increases as well in the mouth. While that happens, there is more milk extracted. So we would have the baby in the sideline position, which is the best position. We want to make sure that their head is supported as well. And we want to make sure that we grab or squeeze their cheeks with the middle finger and the ring finger. So we'll have our bottle right here. And then we will slightly put in the bottle with the rooting reflex and grab the cheeks right there. And just gently squeeze just to make sure that there's stability with the cheeks while we do that. Okay, so that is the cheek support. I'm also going to be moving on to the elevated sideline. That's the bonus part. So the elevated sideline, while we do that, we want to make sure that our knee is up. Let me lower this up a bit. Our knee is up, and then we have the baby here in an elevated sideline position. We want to make sure that they are, their head is supported, their trunk is supported as well, their feet are supported too, everything's supported. And then what we want to do is that we want to grab the bottle. I'm just gonna do it like this so you can see. And then we want to grab the bottle right here. And then we want to elevate our knee like that. And then the same way, we want to make sure that we are grabbing both cheeks with the middle finger and the ring finger. And slightly put it inside very slowly with the rooting reflex. And yeah, and then we do the cheek support. So when you give pressure during cheek support, you have to figure out how much pressure you want to give, just because for that baby, since you don't want to put too much pressure. And yeah, you just want to make sure that they maintain that stability and support. So that is elevated sideline. The next thing that we're going to move on to is external pacing. Let me raise this up a little bit. So yeah, I'm gonna be doing the hierarchy levels of the 3 types of the external pacing. So we do this because the infant is not pacing themselves when feeding, so we have to do that for them. It's the most intervention that we could provide for them. The goal is to get them to an immature normal sucking pattern. Okay, an immature sucking pattern, yeah. So we want to pace every 3 to 5 sucks per as needed, and it forces the baby to take the pauses between bursts, and this will help prevent apnea. So we would want to do the sideline position since it is the best for them. So we will have the baby at the sideline position like that. And then for the first one, it is the bottle tip. So we want to make sure that we tip the bottle while it's still in the mouth. Okay. So we just want to slightly do it. It's a very slight movement. Okay. So with this, the baby will realize that there isn't a lot left to suck. And the baby's brain will tell them to breathe since there isn't that much left. So that is the bottle tip, the first step in the hierarchy. The next one is the bottle roll. So the bottle roll interrupts the sucking reflex. And the goal of the bottle roll is to roll the bottle off the center of the tongue. So we want to make sure that the bottle's in there. And then we just slightly roll it off the center of the tongue to the side so the baby can breathe. Okay, so that is the bottle roll. And the last part of the hierarchy is the bottle removal. And this is the complete removal of the bottle. The downside of doing this bottle removal is that you'll have to restart all over again, beginning with the rooting reflex or any kind of reflex you're using. So you will do this if they don't breathe at all. So you want to just slightly remove it, the bottle, and yeah, you would have to start from the beginning. So that is each hierarchy level for the external pacing. Okay. So that is that. Last but not least is the bottle resistance. Okay. So for this one, we want to slightly take the bottle or the nipple out of the mouth, but not completely remove it. So this will force the baby to take some pauses. And if this, once the infant is latched onto the nipple, it's just a little bit of a slight pull, okay? So it's just while the bottle or the nipple is inside the baby's mouth, it's just a little bit of a slight pull. So, okay, we'll start again. So we go in with the rooting reflex, and then it's just a little bit of a slight pull, okay? So doing this, it would make them suck stronger and it would have more milk come out. So yeah, that's kind of what we want to do. Um, so yeah, that is all the steps for this assignment. Thank you for listening, and yeah, I will see you in class.